Election Day is almost here, and I have the opportunity to ask the candidates for U.S. Senate in South Carolina the same 14 questions. I met with Senator Lindsey Graham in our Fox Carolina studios and traveled to Columbia to meet with Jaime Harrison. Here's what they told me about improving health care. What is your plan to fix health care?
Well, part of my plan is that I believe that we actually need to fix the Affordable Care Act so we can allow it to work. The first step is South Carolina is one of 12 states. 38 other states have expanded Medicaid, and South Carolina is one of 12 states that have refused to do so. And it's not because it's bad policy, because it would bring billions of dollars into the economy of South Carolina. I can tell you this, if you would say to Henry McMaster, I have a plan to bring billions of dollars into South Carolina, to create thousands of new jobs, to save your rural hospitals, would you take it? And all you have to pay, in the first 5 years, you pay nothing, and all you have to pay afterwards is 10% of the total cost. Would you take it? And he would jump on it in a heartbeat. But then you add to the fact, well, it's called Medicaid expansion, and it's a part of the Affordable Care Act. Oh, no, we can't do it. See, people are putting politics ahead of the lives of people in South Carolina, and that's wrong. And I don't care if you're a Democrat or Republican that's doing it. It's wrong to do it. And we need to do this because 38 other states are doing it right now. We are paying our federal taxes, it's going to Washington, D.C., and then those tax dollars are going to 38 other states. We are not getting the benefit of our own tax dollars here in South Carolina. It doesn't make any sense. It's not rational. It's only political. And we are tired of politics. It's about doing what's in the best interest of the people of South Carolina. Let's rebuild the Affordable Care Act. Make sure it's a good public option, because right now, 400,000 people who had private insurance no longer have it. So what do you do when you're in the midst of a pandemic? You need to have a public option so that people, when they have hard times, can fall back and have something. Have something. And not having a plan isn't good enough. Saying, oh, we need to repeal it and not have something to replace it with is not good enough. And so Senator Graham, he's been saying this for a long time, but this is a senator who is trying to rip away health care from 20 million people right now in the midst of a pandemic. He supports a lawsuit right in the Supreme Court that will be heard on November 10th that will rip away health care in the midst of a pandemic. That is not right. It's just not right.
What is your plan to improve health care?
Number one, I want you to have choices in health care. Medicare for all, even with a public option, is a backdoor way to destroy health care in the private sector. Bernie wants to do away with health care through the employer. I want to keep it. If you're down and out, and it can happen to anybody, you're a car wreck away from needing somebody's help, I want to make sure that we get you back up on your feet. But when it comes to health care, I want you to have choices. I believe in health savings accounts where you can take money before taxes and put it in an account and manage it yourself so that you'll have access to doctors. Socialized medicine destroys quality. It destroys choice. And the Democratic Party's plan is to destroy private sector health care and replace it with government-run health care. I will oppose that. What do I want to do? I want to take Obamacare and block grant the money back to each state. South Carolina would get 40% more dollars under a block grant than they currently get under Obamacare, because under Obamacare, 3 states get 35% of the dollars. I'd like to take the Obamacare money, reallocate it to the states, and let South Carolina find the best ways to help South Carolinians. The choice on health care is between Washington and your backyard, between bureaucrats and people you can vote for. I choose to have health care decisions made in your backyard by people that you can vote for if you don't like what they're doing. Democrats want to consolidate it all in Washington to be run by a bureaucrat you'll never meet.
To see more from Graham and Harrison, go to our Fox Carolina News app or our Fox Carolina YouTube channel. Both candidates answer 14 questions you can watch online and in our newscast. I'll bring you updates on air leading up to Election Day.